Good afternoon. My case, I chose case study number 85, which is acute lymphoblastic leukemia. And my case involves a 5-year-old girl named Jay who was brought into the pediatric office by her mother with sudden onsets of being tired, no energy, wants to sleep more often than usual. She, a little bit of history. She was a full-term baby. There was no complications with the pregnancy. Her immunizations are all up to date. She did have measles at the age of 2. She's coming in with also enlarged lymph nodes, liver, and spleen. And the reason for that is showing that it's a sign of an infection within her body. By having, which we will call ALL, short for acute lymphoblastic leukemia, it comes on suddenly. Due to the failure of bone marrow to produce. And most of the problems are, as I said, within the bone marrow, and it often leads to enlarged lymph nodes, the enlarged spleen, and the liver. It also can cause some pain in the bones and joints. The concentrations of the AST and the ALT were abnormal because the ALT is produced in the liver and the red blood cells and within the heart. And the AST is found in high concentrations in her liver, skeletal, and the heart muscles. What does this mean? High ALT levels mean liver disease, the hepatocyte injury like hepatitis, drug therapy, other diseases, and the high AST levels could mean from alcoholism, well, obviously not a 5-year-old girl, but alcoholism, cirrhosis of the liver, hepatitis, and again, drug therapy. And low AST levels could mean uremia, vitamin B6 deficiency, and drug therapy. A spinal tap was performed on this girl, and the significance of a spinal tap is to see if there's anything going on with the bone marrow, and it came back clear and colorless. She does have the T cell lymphocytes, which is her type of the leukemia. The prognosis for this little girl, since it was caught fairly early with initiating treatment for her, very favorable. With proper treatment, she should have a very favorable prognosis. She would be treated with alprazolam prior to intensive chemotherapy. This way it doesn't make the chemotherapy hard on her body. It reduces the morbidity and mortality associated with heavy dosages of chemotherapy. And if you've seen anybody that's had chemotherapy, you know how sick they can get and how weak, and because their immune system is shut down and they have no control over catching viruses and this and that. So by giving her the alprazolam, it'll help with that. And a pardon my pronunciation, intrathecal therapy was done on the patients without any clinical signs of leukemia within your central nervous system, just for the simple fact that it's to help the children prevent the disease from spreading to the brain and the spinal cord. And this is done with those that had the disease and a good possibility of spreading further into the body through the brain and spinal cord rather rapidly. So by doing this to the children, it helped give them prolong their life. Thank you. Have a good afternoon.